Mike, are you okay with this intensity?
Yeah, that's perfect. I think if I had any more, I'd probably be unable to talk.
Yeah.
Hey everybody, this is Mike from Kalkstein Chiropractic. I've got Eddie with me here today, and today we're doing things backwards. I'm going to be the one receiving the treatment. Just to give you a background of what I've got going on, in my left extensor mass of my forearm, I've been having a little bit of pain. It's a little bit sharp, particularly when I'm doing back exercises. So with the lat pull down, particularly kind of during that moment of loading the elbow is when I'm really feeling it. Just to kind of give you a taste of why we're treating it diagnostically, the extensor mass, as we know or may not know, is responsible for cranking the wrist and fingers into extension. So what happens is during the lat pull down, you can particularly crank a little too much on that elbow, on that extensor mass, that group of muscles. That's essentially what I've done. A little bit too much of overworking the area, not enough TLC. So that's why I've got Eddie with me here today. So we're going to do a two-part video. First part will be with Focus Shockwave, our favorite tool here in the office, and the second part will be a laser session. Like you guys all kind of know, Focus Shockwave, we're starting the inflammatory process. We're going to bring in the laser afterwards because that's going to help us get through the inflammatory process just a little bit faster. All right, without further ado, let's get started.
All right, let's see here.
So let me position myself right there. Yeah, Eddie's already treated this spot for me once with the shockwave, and just kind of like we preach with all of our videos, you know, you definitely need to stay consistent with any of your treatments, even if it's acute, even if it's, you know, a very, very, very minor problem. It's going to take, you know, you throwing 1 or 2 sessions at it just to get it taken care of. So that's why we're here. I've got a back day later tonight, so going to be doing some more lat pull downs, the exercises that are aggravating it. So I'm going to hope that kind of treating it prior to will help me get through the exercise a little bit easier. I'll have to pay a little bit more attention to that after stretch and, you know, post recovery, but hoping that we should be able to get through the exercise this afternoon or this evening with less pain or no pain at all. So let's go ahead and get started.
Let's do it.
Yeah, right. Go up a little bit and right there. Turn me up just a tad bit though. But that's going to be the... Oh, you're on the bone right now.
Oh.
A little bit to that. Angle it towards me and up though. Yeah, right there. Yep, there it is. Obviously, you know, a little bit of a trial and error in order for me and Eddie to find the spot, but like I said, this is the second time that we've attacked this particular problem. Just a couple days in separation from one another, so we're pretty keen at this point to right where it is. And you know, again, just knowing the anatomy, where is the muscle group that we're trying to find? Yeah, right there's perfect. Where is the muscle group that we're trying to go after? All just helps the CA with administering this particular modality and just really kind of making sure that we're as efficient as possible with the energy that we're pumping in.
Mike, are you okay with this intensity?
Yeah, that's perfect. I think if I had any more, I'd probably be unable to talk.
Yeah.
I think this is the first time YouTube is seeing your tattoo.
I think so, actually, yeah. Got a little bit of color on there. Shout out Dave Waugh from Stay Humble. So we're gonna hit this with about 1,500 pulses. So we're a little bit about 2/3 of the way done, a little bit over half. So again, we're going to do a little bit of shockwave, and we're going to come in on a second video that we'll follow this up with, and we'll do some laser therapy. Again, just ultimately trying to get all of that inflammation, all of the tendons and tissues, the cells that I've kind of messed up from that overworking with the lat pull down. We're just cleaning it all up. A really nice kind of basic way to think about the shockwave, and this is a really crude way to think about such a nice technology, is it's a scrubber brush. You're scrubbing away all of the gunk, all of the things that cause pain, discomfort, inflammation, and you're going to just replace it with new cells. Like I said, a little bit crude of a way to phrase it, but it's definitely pretty accurate in terms of what you're doing.
Thank you. It's just me back here. Yes. Yeah, girl.
Should be just about done here in a second. So we're sending a little bit more energy than usual into this spot, just mainly because we're trying to test out a couple things with our treatments and just kind of seeing how much we should slowly over time increase the treatments themselves. Obviously the first time you get something done, it's going to be a little bit shorter, but then to further increase the treatments, to further increase the effectiveness of it, you do have to slowly increase your treatments over time, be that either volume or duration. So that's what we're kind of tweaking with right now. Some of you guys might notice this is a little bit longer than a usual session, especially for such a small area. But it's going to be a little bit of a measure of patient discomfort, as well as how often you've gotten that treatment. Now, I have only had this flare up, if you will, for about 2 or 3 weeks now, but this is a problem that I've had before in the past, probably at this point about 2 years ago, so it's been a little bit of time, but obviously I'm wanting to attack it as aggressive as possible, because the last time I did have it was actually around for about 6 months. So anyways, that was our shockwave treatment. Part 1 of part 2 on treating the extensor mass and the elbow there. We're going to go ahead and do a cut. We're going to bring out the laser, so stay tuned for this second video, everybody. But once again, this is Kalkstein Chiropractic, your local Towson, Baltimore area chiropractor. I'm Mike. This is Eddie. We'll see you in the next video.